Just wanted to introduce Dr. Pitcairn, known as like one of the fathers of modern day homeopathy. A little bit about him and my personal connection with homeopathy is one of the veterinarians that I worked for actually worked under him, and so it's really exciting that he's speaking with us today. It is a bit of a controversial topic, so we welcome well-respected opinions. So feel free to be interactive, and if you have any questions, jump right in. So with that, Dr. Pitcairn, would you like to go ahead and get started?
Sure, thank you very much. I thought I would start out perhaps addressing the group. I'm thinking there probably are 3 subdivisions there. Probably some of you are interested in homeopathy as a system that you've had some experience with yourself, or perhaps you would like to learn to use and practice. Probably another group of you that are just somewhat curious and would like to be informed, because when you do get out into practice, you're inevitably going to encounter people coming to you that have used it themselves, clients or colleagues that are using it. So it's good to know what it's about. And probably a third group, more people that are critical of it or skeptical. And I think that's fine. I would say that that's kind of how I was early on. It's good to question, I think, and not just to accept authority. And it's interesting in a way that I did come to have interest in it, because after going through veterinary school and being in practice for a few years, I went back to graduate school and I did a 7-year program in immunology towards a PhD. But nonetheless, coming out of that, I still found homeopathy of interest and ended up focusing on it. So I feel like it was because my mind was open and I was questioning, and I wanted to find out as much as I could what was true. So I welcome you as well. We have, Natalie and I planned this in terms of three meetings, thinking it might be a good way to cover it. It's a large topic, of course. It's a system of medicine that's been in existence for over 200 years. So there's a lot to it in terms of detail and resources and experiences and so on. But we thought it might work to, in this particular first one, to talk about how homeopathy started, what the idea is behind it, how it developed with Dr. Hahnemann, who was the doctor that developed the system. And then I would also like to, in this session, give you a case example. So really kind of 2 parts to it. The second one, we're thinking more of a history of it as it is, particularly in the United States, how it developed here in this country, and its activity within treating epidemics and other problems. And again, I think it would be nice if I could do a case example if there's time. I assume we have an hour. Is that correct, Jody?
We have about like 50 to 55 minutes.
Okay. Okay, good. And then the third one, perhaps I'll give you some example of some of the research that's been done in homeopathic medicine to show its effectiveness. You'll sometimes hear that it's unsubstantiated or that there's no evidence and so on, but that's not really accurate. It's more like the research that's been done just simply is too different for people to want to accept. So I'll give you some examples of that, of some clinical studies. And maybe if there's time, another workup of a little case or something. We'll see. I'm going to learn, too, how much time it takes me to go through this. So let's start with the first part of this one today. I'm going to talk about Dr. Hahnemann, and I apologize ahead of time. I know it can be kind of boring to talk in details about somebody's life, but I'm going to try to make it as brief as possible. But I think if you understand a little bit more how this began, you can see that it was a serious endeavor. It wasn't some kind of a flaky thing. It's surprising to people like me that work in the field how little is understood about homeopathy. People will come in, clients will come in, and they'll say, oh yeah, homeopathy is giving vitamins, or a veterinarian say he's doing it or she's doing it and giving herbs. And it's not like that. It's actually a system that was started on certain ideas, certain principles. And it's not a new age thing, and it's not really flaky either. So I'm going to go through Dr. Hahnemann's life here, how he came upon the idea and how he developed it. And then we'll move from there, as I say, into a case example. So this fellow was named Samuel Hahnemann, and he lived in the area that's now Germany. It wasn't called Germany at the time, but you know, that part of the world. Here's a picture, one of the few paintings of him. And you see he lived from 1755 to 1843. And that was the time then when medicine, of course, was different than it is today, but still the system of medicine at that time was, in its philosophy, it was very similar to today's prominent one. So Hahnemann was born in 1775, and he was the third child in the family. And it was somewhat interesting how he was raised, because his father was a painter, actually worked in a porcelain factory painting dishes and cups and things like that. But his father basically taught him to study on his own, and oftentimes would give him a problem. When he'd go off to work, he'd give him, okay, here's a problem for you to solve today, and I'll come back into the day and ask you for the answer. And so little Samuel would work on that and basically develop his mind. And we don't know if that was an important factor or not in how he developed, but certainly it was unusual. He became a very excellent student, and at that time it was very expensive for someone like his father to pay for education, so he couldn't really afford for him to go to school, for his son to go to school. But the local school noticed how good a student he was, how smart he was, and they offered him free tuition. So he did go to school. By the time he was 12 years old, he was tutoring other students in Greek language. When he was 20, he went to the University of Leipzig, and he was hired then by the governor of Transylvania to put his library in order and to be the family physician. I guess it was a little looser those days as far as whether you could be the physician. In 1779, he returned to Germany, completed his medical degree in 1779. He was then appointed to be the medical officer in the town of Gomern, and part of his job there as a physician and medical officer was to control and supervise all the pharmacies of the area. He had quite an interest in chemistry himself and use of medicines, and so he had become quite an expert. He'd written a book on it that was kind of a standard textbook, and so interestingly, that was one of his jobs. He practiced all the different forms of medicine, including surgery, and wrote several articles about medical practice. But he developed this ethical dilemma. He'd gotten his medical degree in 1779. He'd worked as a physician. By 1790, he withdrew from practice. And if you'll bear with me, I'd like to read this to you, because I think it's very informative as to what his character was like. And this is in a letter that he wrote to a colleague. And he says, "It was agony for me to walk always in darkness, with no other light than that which could be derived from books, when I had to heal the sick, and to prescribe according to such or such an hypothesis concerning diseases, substances which owed their place in the materia medica to an arbitrary decision. I could not conscientiously treat the unknown morbid conditions of my suffering brethren by these unknown medicines, which being very active substances may so easily occasion death, or produce new affections and chronic maladies, often more difficult to remove than the original disease. Become thus the murderer or the tormentor of my brethren was to me an idea so frightful and overwhelming that soon after my marriage I renounced the practice of medicine that I might no longer incur the risk of doing injury, and I engaged exclusively in chemistry and literary occupations." He had learned several languages, you see here at the lower part of this projection. He knew Greek, Latin, English, Italian, Hebrew, Syriac, Arabic, Spanish, German, and some smattering of Chaldaic, which I had never heard of before, but I looked it up, and it's apparently some kind of an Asian language. So just to give you a little more idea of what he was dealing with, in those days there were use of a lot of powerful substances and herbs and even poisonous material. They used a lot of aconite, which is from monkshood. Remember, if you studied in school, that's a poisonous plant. A lot of mercury. Mercury was used like steroids are used today. It was used in almost everything. And a lot of patients would have mercury poisoning. Their teeth would fall out, and they get terribly sick from it, sometimes permanently. Bloodletting was very popular, where they would withdraw people's blood in large quantities, thinking that would help them. So he didn't want to do this anymore. He felt it just was too unreliable. He didn't want to hurt people. He was very ethically concerned about this. So he supplemented his income by translating books, medical texts, mostly, well, not mostly, but many of them about chemistry, but also other medical works because of his knowledge of languages. The important point as far as the development of homeopathy was in 1790. He was working on a book by Dr. William Cullen, who was a Scottish physician, and Dr. Cullen was a very respected, prominent authority in the medical field at that time on the use of medicines, materia medica as it was called. Kind of like if you can think of some veterinarian professor that's very prominent now that's kind of an authority. It was like that. He was recognized, Cullen was recognized around the world as this very important figure and very knowledgeable and so on. So Hahnemann was translating his book, probably into German, I suppose. And there was at that time a great, one treatment had become very popular, which is the use of this, this material from the bark of trees in Peru. It's called Cortex peruvian, or Peruvian bark. Had been brought by missionaries back from South America to Europe. And because of its use down there in South America. And as it turned out in using it, again, they just use these things without any particular knowledge or guidance, except just to try them in sick people. That was the way it was done in those days. And when they used it, they found it was really highly effective in some fevers. Fevers, kind of like malaria would be, that type of pattern. People were quite ill with the fevers. It was a very serious problem, and it was difficult for people to treat it successfully. So this was really exciting, and a lot of doctors are using this material now. And Dr. Cullen had written about it. He put 20 pages into his book about the use of this. However, he suggests that the reason that it acted in fevers is because of its bitterness. Who knows why he thought of that, but it was called a stomachic. That was the term that was used at the time. It was a very bitter herb to strengthen the stomach. Hahnemann writes in the margin of his translation, he says, this can't be quite right, he said. There are other herbs that are more bitter than this one, and they don't have the same effect in fevers. So it can't be the bitterness. So he decides to test it on himself and see see if he can figure it out. Why does it act the way it does? So he makes a tea out of it, so to speak. He makes an infusion of it. He uses a ½ ounce of the bark and soaks it and then drinks it like a tea. And he has a reaction to it after doing that. He produces these symptoms that he recognizes as symptoms typical of the fever. And these symptoms last about 3 hours and wear off. And then when he makes another cup of tea and drinks it, he has the same experience. And he does it several times so he can see that it's repetitive. Here are the symptoms that he experienced, that he lists. His feet and fingertips become cold. He becomes very languid and drowsy. He has heart palpitations. His pulse becomes small and hard. He felt great anxiety. He was trembling. What they call prostration of the limbs, which would mean, we probably wouldn't use that term. We would probably say the limbs felt heavy or weak. Difficult to use them, the arms and legs. Pulsations in his head, redness of the cheeks, and excessive thirst. Now, he recognized that all of these symptoms that he experienced, except for actually having an elevated fever, were very typical of what the diseases that this particular bark was effective in curing. So that was an odd thing. And so he had the idea, maybe what it does, maybe the medicine is acting the way it does because it was able to produce similar symptoms as a natural disease. It was a new idea. He'd never thought of that before. And, of course, it may or may not be right. But he thought, well, he says, it could be. Maybe somehow by mimicking the disease, it does something. So he began to investigate that idea. And he tested other substances that were used at the time, other medicines that were used, other herbs and animal products and minerals and so on. And as he tested them, he found that, indeed, he was able to produce symptoms. And he spent this period of 9 years doing this from 1990 to 1999. And he did this with a number of volunteers, other doctors, students at the medical school, his family and friends, and so on. And then he took that information, he set up we're not going into detail about this, but he set up guidelines as to how this was to be done, in the sense that he was only going to test it in people that were healthy, that didn't have symptoms, so he could see exactly what the substances did to them. And he also tested each one by itself, because at that time, medicine did not really use, doctors did not really use single substances, or very rarely use single substances. It was combinations of many things together. Could be 10, 20, 30 different herbs and minerals and plant material formulas that the pharmacist would make up. So this was unusual too, just to test one at a time by itself. And his idea was, I want to find out more specifically exactly what it does, so I know when I use it what effect it'll have on the patients. The results of this study were collected in reference books, and one of the earliest ones that he did, one of the earliest publications, was entitled Materia Medica Pura, which means the pure action of medicines. And he called it that, the pure action, because he felt like he had studied the action of that one medicine by itself without the contamination or influences from other ones. It's just more of a clear pattern of its effects. So, in going over this, you can realize that one of the things that was unique here, whether you like homeopathy or you don't like homeopathy, was he was the first doctor to actually set about testing substances in volunteers before using it. This was a major step forward in medicine. We now assume that it has to be done this way, but it was Dr. Hahnemann that first introduced the idea. So then, of course, he's going to test it clinically eventually. So after this 9 years of gathering information, he decides to take up the practice of medicine again and try this. By this time, because he was making his living translating works as described before, he had produced more than 5,000 pages, which is quite amazing. Because he'd given up medicine voluntarily, he basically lived kind of close to poverty. He didn't make the same money he'd made as a physician. He had a family. They lived in a one-room place, and because he had children and it was noisy, he did his translations. The only way he could make it work was he hung a blanket up in one corner of the room where he had his little kind of work area, his little desk, and he would stay up every other night and work on his translations. In other words, he'd only sleep every other night, and that was the way he managed to make a living. In 1792, he had been given, during this period of time of the study, he'd been given charge of a mental hospital. And there was a fellow there that was a minister of police that went berserko, and he was very respected by the, I want to say government, that's not the right word, they had like kings and princes and things, but whatever you want to call it. And so Hahnemann was asked if he would treat him. And so he did. He went in, and this fellow was quite seriously disturbed. He would rave, and he would have hallucinations, and then tear off his clothing and tear up his bedding, and took the piano that was there to pieces, and rambling in different languages. Hahnemann treated him over a period of a few weeks, and he completely recovered, came back to normal. So that was quite amazing, and people were impressed by that. And here's a little quote from Hahnemann. He says, "I never allow an insane person to be punished, either by blows or any other kind of corporeal punishment, because there is no punishment where there is no responsibility, and because these sufferers deserve only pity and are always rendered worse by such rough treatment and never improved." Well, this seems like this seems self-evident to us, but you will realize the significance of this if we go back to that time. the people that were considered insane were put into institutions where basically they were severely punished and tortured. There was no counseling. There was no real care of them in the way we would think of it, but rather they were controlled. So they were tied up, they were starved, they were given medicines that make them vomit and have diarrhea. They were put in, they had a kind of a chair that would spin very rapidly to make them dizzy. They had a board that would go from vertical to horizontal rapidly to shake them up. And they would use whips and so on. So that was kind of standard treatment. So Hahnemann, again, was unique as a medical doctor, putting homeopathy aside, and saying to the profession that an insane person shouldn't be punished. That this is not the way to do it. So this is another thing that was remarkable about him. So I want to talk we're skipping quite a bit here about his career. He worked over 50-some years in clinical practice, of course. But I'm going to just show you a little bit about homeopathy in Europe as it developed. In 1813, there was a typhus epidemic. And typhus was, the way to understand that in people is to think of it as kind of like parvo. It's the same kind of a disease. People got terribly ill with it. Many, many died. So there was a typhus epidemic in this year, and Hahnemann cured 178 out of 180 cases using the homeopathic method. And this is a mortality rate of 1%. At that time, the allopathic mortality rate was between 20 and 30% with the methods that they used at that time. So, of course, that was impressive. And a lot of doctors, when they saw these results, gradually became interested, and they would study what Hahnemann had to share and get the books about the action of medicines, and they too became practitioners. So homeopathy spread not only through Germany but also to other countries and eventually around the world. Dr. Hahnemann vigorously opposed bloodletting. It was standard practice during infectious diseases to do bloodletting. And bloodletting was, believe it or not, bloodletting existed for over 3,000 years. It really didn't fall out of favor until the 20th century, middle of the 1900s. And even now it's still done in some parts of the world. And bloodletting came about as a medical practice because it was people that at the beginning of it did not know how blood was formed. It was thought blood was created in the center of the body and it flowed out to the fingers and toes. And that when people were sick, the blood became bad, so they had to remove it. They didn't know that the heart pumped blood. They didn't know blood was made by the bone marrow and so on. So this idea of draining the blood out was quite a popular thing. And it did have some effect in the sense that when somebody would come in very sick, say with a fever or severe symptoms, and you drain quite a bit of blood from them, then they get very weak and a lot of their symptoms subside. But which really wasn't a cure, but it was apparently an improvement enough that people stayed with it. He got into trouble because of his opposition to bloodletting. I mentioned this Emperor Leopold of Austria. Emperor Leopold became ill in this way, and he had several doctors that came in and treated him, and he had blood drawn from him in large quantities 4 times before he died. And he died very uncomfortably, vomiting and diarrhea while people watched him expire. So it was a terrible thing. And so the information was published at that time about what had happened to him. And Hahnemann looked at that, and he calculated how much blood had been withdrawn, and he basically said, you'd taken all the blood out of his body that he had. And this is not the thing to do. And he published an article about that, or a response about that, and it got him into a lot of difficulty with the medical profession. He was severely criticized for this. And when he would try to publish information about his results, pretty much routinely newspapers and journals would reject his articles. So from the beginning, homeopathy had opposition, and mostly because it was different, and it threatened the doctors that were doing what they were doing, because he was critical of this. He said the kind of treatment you're doing with all these doses of mercury and bloodletting and so on are really harmful. They're not helping your patients. So of course there was controversy. Here's just a few more examples of treating epidemics and showing you why there was interest in homeopathy and why it spread. There was an epidemic of cholera in 1831, 1832. Cholera, when I went to veterinary school, I learned about cholera as being a disease primarily of severe diarrhea in people. But it's interesting that this is more the contemporary pattern. Back in Hahnemann's time, cholera was more severe, and it wasn't unusual that somebody would, that was developing it, would suddenly become very weak and collapse, would faint, and they would die within 2 or 3 hours, even before there was diarrhea. It was a very rapidly killing thing, and people were very frightened of it because of the high mortality rate. So here in a place in Hungary, for example, there were over 1,500 patients treated in the conventional allopathic method there, and 640 of them died, which is a mortality rate of 43%. In the same area, Dr. Bacotti, who was a homeopath, treated 154 cases, and 6 died, which is a mortality rate of 3.9%. Well, of course, one could argue that, well, he fudged his figures, or he wasn't honest and so on. But Dr. Bacotti actually produced 112 legally attested certificates of the results he had from the people in the community that were reliable and influential in the town to show that they said, yes, this is exactly what happened in their community. In Russia, allopathic treatment of 93 patients with cholera resulted in 69 dying, a 74% mortality rate. Dr. Cedar, a homeopath, treated 109, of which 23 died, which is a 21% mortality rate. And then another thing was Hahnemann had given advice. He had studied the very early symptoms of cholera, the stage that I described to you where people would suddenly become very faint and weak and collapse. He found that it corresponded to camphor, which was used as a medicine at that time. And he said if you take a few drops of camphor on the tongue immediately upon having these sensations, you can avert the disease, which is what he had found with his patients. So he published that, which pissed off a lot of doctors because he was giving information to the general public. But the public picked it up, and here's an example of Thomas Count Nadesty in Hungary describes his experiences using that method, because at that time in the cholera epidemic, they didn't have any medical treatment available to them. So he treated 161 people given these drops, and only 14 died, which is an 8.7% mortality, which is strikingly low. Again, this was supported by the testimony of 70 sworn witnesses, because, of course, you can quite understand that people would say, oh, no, that can't be right. You're exaggerating, you're making it up, it's placebo, and so on. So at least he got testimony to say, no, this really happened. This is what we saw. And his final years, we're almost done here with this part. The final years, his wife had died some years before, and he was elderly now. Hahnemann had kind of retired. And this woman, Melanie, from Paris, traveled to him to get treatment because she'd heard about him. She was a feminist, artist, and poet, and she traveled to Paris to be treated. It's interesting, at that time, women were not allowed to travel by themselves. They had to be accompanied by a man. But she couldn't arrange for that, so she dressed herself as a man and traveled by, of course, stagecoach or whatever the equivalent was, wagon, I guess, and traveled from Paris to Germany. Became his patient, was treated by him, and she recovered and became interested in homeopathy and in Hahnemann. And in January 1835, the two of them were married. He was 79, she was 35. What a rogue, huh? So then in June, they moved to Paris, and they opened up a homeopathic practice, and he worked there until 1843, the two of them, and dies at age 88. And this is why homeopathy is prominent as it is in France. Some of the remedies like boron come from France, because the last years of Hahnemann's work were in France. I think that's the end here. Yeah. So that's all I was going to say about Hahnemann, then we'll go to a case. Are there any questions at this point that we should cover, or should we just move on?
Any questions? There aren't any questions right now. Keep going. Okay.
So I'm going to present to you a case here. This is a horse, Alberto's mare. This is an example of wound healing where just homeopathic care was used. There were no antibiotics or any other drugs, any pain drugs or anything used during this treatment. So here's the injury. The horse came in from pasture like this. The reason for this wasn't really known. This horse was out with other horses, and possibly there might have been a wire sticking up from a telephone pole, but nobody really knows for sure what happened here. But as you see, it was a pretty serious injury. Here's another view of it from the side. The person that had this horse is a veterinarian that does homeopathy. He was studying with me at the time, and so he calls me to see what we could do for treatment, but not immediately. So let's go through what he did first, and then we'll pick up when we started treating it. So first thing he did, of course, was suture it up. So this is 1 week after the injury. He had sutured it. And if any of you have tried to do this in horses, you know suturing doesn't work very well. They're so powerful and tissues are so strong and their movements are such that those things usually tear out. There are some things you can do like run the suture through tubing and so on, but still, even so, it's very hard to keep a big wound like this closed with suturing. So what was happening was it was opening up again. And you see it beginning to open here at the top. And here's more of a close-up of it. You can see the wound looks kind of nasty. And this, on the right side, you can see kind of a darker border here where the suture, probably those are the sutures, are becoming isolated, dying. Here at 10 days after the injury, now this has completely reopened. And the part hanging down here is the suture line, what's left of it, pretty nasty. And he cleaned the veterinarian here had cleaned it up a little bit, washed it off and so on, and tried to clean it up as best he could. And here's a picture of, there was this girl's horse here. So here's where we start homeopathic treatment, March 9th. And you can see what it looks like. It's already trying to heal itself. You can see there's some granulation tissue appearing underneath, or at the bottom rather, to some degree. And you can see how big it is here with the ruler. And here it is at 22 days, and it's about 2 inches deep. So this what we're showing you here is after we started to do some treatment, the fellow and I. And here's 28 days, and the 5th week. And during this time, the horse was quite comfortable, didn't have any pain, any apparent discomfort, didn't mind it being touched once we started treatment and so on. Here's the 6th week. And 7th. And here it is, finally healed with a scar. So what did we use? Saline washes. Made up saline and washed the wound off once or twice a day to keep it clean. The first remedy we use, homeopathic remedy, is called arnica. And many of you probably have heard of it or maybe used it yourself. And the second one, not at the same time, but later, a week or so later, we use calendula. You may have heard of that one too. It's an important remedy for wounds. And then the last one we used was Calcarea carbonica. All that by tradition, because this started, 200 years ago. At that time, the major language for medicine was Latin. And so all of the homeopathic medicines are in Latin, whether they be herbs or minerals. And calcaria carbonica is calcium carbonate as a homeopathic remedy. So why arnica? Well, arnica, when it was tested in healthy people, it brought up sensations similar to an injury. They felt like they were bruised. They had soreness of the muscles and the tissues. There was pain. And with clinical experience using it, it was found it was very good also for the inflammation that followed an injury. It also was found to be very specific for bleeding after injuries. There's many homeopathic remedies used for bleeding, but arnica is very good when the bleeding follows injury to the tissue. It also has been found to prevent the formation of pus and also septicemia. So it's often a medicine that's used for what's called soft tissue injury, as opposed to, say, bone or cartilage and other tissues. And then calendula. Calendula is used what were called at that time flesh wounds. I don't think we use that term anymore. But where there was an injury like we saw in this horse, where there was injury to the muscle and tissues, and the patient, in response to it, becomes pale and kind of unresponsive. That is, like they're a little bit weak and faint, sort of, I guess you'd say. Not responding when you ask them a question, they don't really respond to you. It's also for patients that have been exhausted from loss of blood. They've lost quite a bit of blood, and they also have a great deal of pain, especially wounds that have been lacerated. They're called lacerated wounds, where there's been a cutting of tissue, like with a knife or a spear or something. It's also very good for large wounds that remain open, where there's been a lot of loss of tissue. So calendula is more specific for that kind of wound. Arnica, as we mentioned, is good for injury, but it doesn't so much correlate to very large wounds like this that remain open. Calendula has also been found to stimulate the production of white blood cells and connective tissue repair. It's one of the few substances that's actually been found to stimulate epithelialization of tissue. Another one is chlorophyll from plants will do that. I think there's a couple of others I can't remember right now, but there are very few that have actually been shown to do that. Many of the things that are commonly used, like antibiotic creams and different kinds of ointments, actually have been shown to slow down epithelialization, surprisingly. And lastly, it promotes healing by first intention, so that it heals without any secondary problems or infection. And then the next one, calcaria carbonica, it is used specifically. It's in the history of homeopathy, in the literature. Oops, sorry about that. I should have unhooked the phone. It'll only ring 3 times. So in horses, this substance has been found to be particularly helpful to prevent the formation of pus that they call unhealthy. That is, pus that doesn't look like it's part of healing, but it's like there's infection or something. It's very bad smelling, kind of like there's dying tissue. It's also used for wounds that remain open, like calendula, that don't heal, or that remain raw and inflamed and are very painful. And the last thing, it desires to eat earth. The patient wants to eat dirt or clay or coal or chalk. So the reason for using it here, and I should say first of all that these 3 medicines that I mentioned to you here were all given by mouth as little pellets or dissolved in liquid and water and given by mouth. They weren't put on so much put on the wound, though some calendula dilution might have been, I don't remember. But these were given by mouth as homeopathic remedies. And like this one, calcaria carbonica, was only given 1 time. And the reason we gave it is that towards the end of the recovery, as the horse was healing, several weeks into it, it began to go out and eat dirt off the ground, which it had never done before. And when we saw that, we realized this is the medicine that was needed to finish the healing. Okay, so here we go. Horse is recovered, and that's it. That's what I have.